to make 3 points. First one, that stroke and Alzheimer's disease occur commonly and commonly together. Secondly, that they share the same risk factors, which means we know we can prevent stroke, and I'm trying to persuade you that we may be able to delay Alzheimer's disease. And finally, there are certain things we need to do if we are to achieve this. You already heard that 1 in 3 of us will end up with a stroke, Alzheimer's disease, or both, unless we improve treatment and prevention. We carried out a study in Canada, this is called the Canadian Study for Health and Aging, in which we asked the question, how many Canadians over the age of 65 have had a stroke? The answer is 8%, that's the red bar. If the question is, how many are demented? 8%, that's the blue bar. But for each person who has a stroke or is demented, there are 2 people with some cognitive impairment, some change in their thinking that doesn't amount to dementia, but that predicts that they're more likely to develop both stroke and Alzheimer's disease. So one of the points I'm going to make is that it's never too late, but earlier intervention is better. Now, the other thing that we asked was, if you have a stroke, are you more likely to develop cognitive impairment? And if you have cognitive impairment, are you more likely to develop a stroke? The answer is yes and yes. A Canadian over the age of 65 suffering a stroke, 64% of them will have some cognitive impairment that will interfere with the quality of life. If you ask the question the other way around, how many people who have some cognitive impairment have had a stroke? 25%. So clearly there is a relationship, at least at the population level. Now, we have known for a long time from studies from 3 continents that about 20% of individuals who suffer a stroke will end up with significant cognitive impairment. But the mechanism has been unclear. How come? Now, the most persuasive evidence comes from the nun study. What was done is that all the nuns in a particular convent agreed to donate their brains when they died. And it turns out that when they examined their brains, only 57% of those who had the pathological diagnosis of Alzheimer's disease had any difficulty in life. If they in addition had a stroke in the hemisphere, in other words, the cortex, the rind of the brain, then 75% of them had difficulty in life. And then if they had 1 or more small, deep brain infarcts, then 93% of them did. So clearly the story here is that having Alzheimer's changes is not that uncommon, but that there is a trigger, and that trigger is stroke in a number of cases. So we know we can prevent stroke. Then the question arises, can we then delay Alzheimer's disease or even prevent it in those who don't have a severe case? So what David Chiquetto, who's a professor in the Department of Anatomy at the university, and I developed an animal model to study this interaction. And the only part I want you to pay attention to is the bottom bars. And what you can see, first of all, I want you to pay attention to the black bars at the very bottom. And one is at 7 days, and one is at 28 days. What that means is the volume of the infarct, in other words, the size of the stroke. At 28 days, it has shrunk. However, if we produce the same stroke in the presence of amyloid, amyloid is an abnormal protein that gets deposited in Alzheimer's disease, then the stroke is much bigger. That's that first gray bar. And after 28 days, instead of shrinking, it is actually grown. If you looked at inflammation, then if you have amyloid in the brain, then there's much more inflammation if you produce a stroke. And after 20 days, instead of settling down, it actually flares up. Now, the good news is that we can prevent the stroke from growing and the animals from deteriorating cognitively because we give them memory and learning tests if we give them antioxidants and anti-inflammatory agents. So clearly, we have found a connection. One of the reasons why some people seem to be coping all of a sudden they have a single stroke and they're tipped into Alzheimer's disease. So, and this is a treatable mechanism. This is what's so promising about it. Now, I already said that all the major risk factors for stroke are also risk factors for Alzheimer's disease. And I think you know them all. High blood pressure, high cholesterol, overweight, diabetes, smoking, high levels of homocysteine, and stress and depression. There are also certain things that seem to be protective. I think being educated means that you probably have a better outlook than if you were not. We know that physical activity is something that encourages overall health and brain health. We know that alcohol consumption, by the way, in moderation is a good thing. Beyond a certain limit, it's not such a good thing. And I'm afraid that I'm going to say something may be politically incorrect. That is that for women, it's 1 or 2 drinks a day. For men, it's 2 to 3. But the simple reason is they're bigger people, and they have more water to dilute it in. It's a fact, actually. I have other reasons, but I mean, that is a fact. But beyond that, it becomes neutral, and if, again, you drink excessively, you're more likely to develop both stroke and Alzheimer's disease. So clearly, this is one of those that you may want to watch. And then there's some evidence that antioxidants and fish oils may help somewhat, and certainly treatment of hypertension and statins for high cholesterol are things that have been well proven. Now, this is simply to show you that by lifestyle alone, one can decrease the common type of stroke, which is called ischemic. In other words, there's closure of a blood vessel, and then the part of the brain that is supplied by that blood vessel then dies, and that's called an infarct. And so as you can see, it can be reduced by 50%. Now, there's a study that has not been fully published called Interstroke, in which they studied stroke in 22 countries, and they identified 10 treatable risk factors that accounted for 90% of the strokes. So clearly, the great challenge of treating risk factors is that we're talking about changing human behavior, which is very difficult. But nevertheless, we have the tools for preventing stroke and perhaps delaying Alzheimer's disease. Now, let me do a little survey here. We also know the risk factors, but we also know that genetics matter. How many of you, if you learned that you had the ApoE4 gene, which makes you more prone to develop Alzheimer's disease earlier and more severely, how many of you said, to heck with all this lifestyle stuff, I'm going to drink, I'm going to eat, I'm going to enjoy life? How many would do that? You're brave. This is a very sober group. How many would do the opposite, saying, oh my goodness, I'm big risk, I better drink life to its lees, really control the risk factors and try to eke out healthy living? How many would do that? Wow, gee. I'm not sure I have much to tell you. I think you're doing the right things here. Now, this may be the most important slide I'm going to show you. And I'll spend a little bit of time on it so you can understand it. If you have high blood pressure in your 50s, you have 2.5 times the risk of developing dementia when you're in your 70s. So hypertension is one of those treatable risk factors. If you're unlucky enough to also have the ApoE4 gene, then the likelihood of developing dementia in your 70s, if you have high blood pressure and the wrong gene, is 11-fold, more than 10 times. That's the bad news. Now I want you to go back to the first column where you see midline high blood pressure and E4 plus. If, on the other hand, you treat the risk factors, if you have the wrong gene, you gain much more. And notice that if you have high blood pressure, then it's 1.5, like 1.5 times, and here is, say, twice. So in other words, those who have the wrong genes have the greatest risk, but they also gain the greatest benefit from controlling risk factors.